An analysis from the Center for Disease Control shows that there has been a 24% increase for post-rape reports in the pandemic, increased teenage pregnancies, and social pressure due to job loss, fears for the future, and close confinement with the intimate partner. These are considered most common causes of increased violence.
There's been a significant increase in incidences of sexual abuse and gender-based violence in Uganda, as well as increase in teenage pregnancies. An analysis from the Center of Disease Control showed that there has been a 24% increase in post-rape reports in the pandemic. Increased social pressure due to job loss, fears for the future, close confinement with intimate partners are considered most common causes for the increase in this violence.
It is on this background that Plan International has embarked on the campaign to sensitize the young girls and update the country with the aim of promoting the girl child education, and this will last for 5 years.
Dramatically impacting the ability of girls to return to school. And a number of assessments are underway at the moment on this, but we know that this is already the case. Plan International has recognized this situation in the update of our country strategy, which will span from mid-2022 to 2027, and which puts girls at the heart of our interventions. We want to make sure that children and youth, especially girls, are able to develop their full potential in communities that promote their rights and their gender equality.
The head of program at Plan International, Karen Beaumont, says that they want to make sure that children and youth, especially girls, are able to develop their full potential in communities that promote their rights and gender equality.
But above all, what we will be doing is we will be listening. We will listen to girls as they explain their issues and identify what will improve their situation. We will help girls look at the evidence and the data and use that to support their arguments and assist to get them into situations like this where their voice is heard.
She stressed that their focus on promoting the protection of girls from early marriages and forced marriages, also unplanned or undesired forced pregnancies, sexual violence, and others, while enabling access to the use of adolescent sexual and reproductive health. She added that at the same time they want to focus on supporting learning and enabling quality learning experiences for children from early childhood to working age, while building their skills for life and work in and out of the school setting. Over half of Uganda's girls who gave birth before 18 years have a second or third child before they reach the age of 20, a trend that hasn't changed for the past 30 years.
For themselves, almost a third of adolescent girls in Uganda give birth before their 18th birthday. And over 34% were married or in a union before the age of 18. With these figures, Uganda continues to rank among the 20 countries with the highest rates of child early and forced marriage worldwide.
42% of pregnancies among adolescents in Uganda are unintended. Key reasons for this are low levels of availability and use of contraceptives, particularly for adolescents. Almost 30% of women aged between 15 and 49 years report having been subjected to physical or sexual violence by a current or former intimate partner in the past year. According to Karen, childhood and forced marriages play an important role in these numbers. The range of factors within such unions are increasing girls' risks to experience intimate partner violence.
Over half of Ugandan girls who give birth before 18 have a second or third child before they reach the age of 20, a trend that hasn't changed in the past 30 years. 42% of all the pregnancies among adolescents in Uganda are unintended. And the key reasons for this are low levels of availability and use of contraceptives, particularly for adolescents.
This report has been filed by Chiyinji Godfrey and Gloria Nabkalu for BTM News Today.